Great. Thanks, Tom, and thank you to the IOM for enabling me to participate in this event. So the title for kind of my 10 minutes is going to be Innovations in Scheduling, New HIT Tools that Empower Patients. I'd like to start kind of along the vein that several have brought up today from a patient perspective. I know, kind of before I go through this little vignette, that many in the room are kind of part of and lead organizations that are doing extraordinary things in healthcare right now and are kind of at the vanguard in terms of performance and value. However, unfortunately, there are many organizations where, quite honestly, that type of care is not being delivered currently in patients. There's opportunity for improvement, and I think that's one of the reasons we're here. But, I can speak from personal experience as to kind of what sometimes a typical interaction with scheduling can be like, and it goes something like this. If I want to make an appointment with my physician, or somebody in my for somebody in my family, I'll call up between 9 and 12, or between 2 and 5. Even if I call up during that time, the phones may be forwarded. I may be on hold anywhere from 2 to 7 minutes, but sometimes longer because I just can't afford to hold that to continue holding after that. When you do get on the phone, you ask, "Can I be seen today?" Usually the answer is no, and so you ask for when is the first available. The first available is, let's say, next Wednesday at 9:30. That doesn't work. What's the next available? It's Thursday at 4:30. That doesn't work. So on the third time, you get one, and you can't go on like this for a long period of time. Both the scheduler and you have to kind of get on with the day, so you take the third appointment or the fourth, and that's the one. It's not usually the best fit, but it's one that you need to take. And so what that results in is some of the no-show, I would say, some of the no-show phenomenon that we see. And to the point that patients do not feel like they are active agents in their care, that they are participants in their care. Several of our clients have engaged, and one in particular that I'm going to speak to, having basically taken this problem on and have innovated around it through patient portal scheduling, and so that's what I'm going to talk about. Oh. So the organization I'm going to talk about is MU Healthcare in Columbia, Missouri. They are a long-term strategic partner with Cerner, and they decided to basically re-engineer the way that their patients scheduled appointments. They put the patient at the center, and they looked at the holistic process with the understanding and the idea that the appointment was a means to an end, in the sense of the goal was the clinical interaction. And as some folks have already mentioned today, there may be opportunities with healthcare information technology where an actual appointment or face-to-face visit is not needed. Perhaps a televisit, either asynchronous or synchronous, or some type of secure messaging could take the place of that. But how could they utilize health IT tools to improve that process? This work was done at the Tiger Institute, and much of in the information that I'm going to discuss going forward was really outlined by Mitch Wasden, who's the CEO of MU Healthcare, a couple of weeks ago at our corporate conference. So quickly about University of Missouri Health System. They have 7 hospitals, 7,500 employees, 500 physicians. They are very committed to utilizing information technology to improve care and drive value, and they've translated that into high performance from a quality, safety, and efficiency standpoint. But really the question is, what have they done? How did they utilize patient portal scheduling to improve the patient experience, and what does that look like? basically they created a they simplified their appointments by cutting them from roughly 100, which somebody alluded to earlier, down to less than 10 for the primary care physician. They then enabled on the back end for basically patients to go in and open schedule. They used what human factor engineering, what we call usability testing, in an iterative way to develop a very simple and easy patient interface that was available 24/7. So the idea is that instead of somebody getting on the phone, and potentially having 3 or 4 options for when they could be seen, they could bring up their provider's schedule and see basically 10 potential appointments. And if they didn't see one that they liked, they could page forward and see another 10. And then if they didn't see another they liked, they could see one more page. So basically you had 30 potential appointments, and the patient could figure out and choose the one that truly worked for their schedule, as opposed to having 3 or 4. The results of this were that their no-show rates were cut by 50%. So it had real applicability to a patient-centered outcome. And so from their standpoint, the appointment was important, but as or more important was whether or not the patient actually showed up and got the clinical intervention. So that's one area where they have been innovating. A second that they are currently in development is working to develop through their patient portal the synchronous and asynchronous telehealth visits. Synchronous will obviously be a direct encounter with a healthcare provider in real time. Asynchronous, they're looking, and of course we know that there needs to be some type of triage there to make sure that patients are not kind of engaging in telehealth when there's a degree of potential risk or there's a serious medical condition that requires them to be seen. But the idea is that they can utilize asynchronous, either text, a picture, or video, and correspond with their provider. Finally, in the telehealth vein, they're looking at actually not going through basically not looking for reimbursement initially. They're going to charge patients a flat fee, and they're also going to kind of migrate that to a mobile platform. So again, to address some of the capacity issues that folks have brought up earlier, I think telehealth has a big opportunity to increase the ability of folks to be seen when an in-person visit is not required. So finally, in terms of challenges, I think many of these have already been brought up, but aligning incentives is an important one, especially as patients increasingly are called on by high deductible plans to become more prudent shoppers. Now, of course, we know that during an acute condition that requires hospitalization immediately, that dynamic probably will not have as big an impact, but creating incentives for patients to choose efficient, easy, quick, and high-value services is important. As somebody talked about earlier, limited access to IT resources, especially kind of in rural communities, is a challenge. Interoperability and change management is an area where even one of the things that MU discussed was the fact that they needed to get buy-in from their physicians, and initially there was a fair amount of pushback from the physicians, but ultimately they were able to kind of make the change. So finally, just some take-home points. Feel like the consumer movement in healthcare will certainly shape innovation in scheduling. I think that's fairly obvious, but it will also continue to shape care far beyond that. simple and easy, as well as kind of an iterative end user, and patient-centered approach is going to be best, and finally embed intelligence into the system with business logic and rules. Telehealth will expand provider supply and offer an increasingly wide variety of clinical interactions. And we feel that the larger forces that are currently impacting healthcare will continue to accelerate. And the ability to re-engineer processes and continue to improve will be an important component of healthcare organizations' long-term success.
Thanks, Wes. I'm sure there'll be questions and comments for you after we're finished. I'll turn it over to Zelda.